Prostate enlargement or benign prostate enlargement is a very common condition affecting almost all men from 50 years old onwards. Studies have shown that in a man of 60 years old, up to 60% of them may suffer from some form of benign prostate enlargement.
One of the top health topics related to men will be the topic on prostate. Prostate enlargement is very common among older men. Let us explore the various safe and effective treatment options.
In this less common group, comprising about 10% of our prostate enlargement patients, we would have to subject them to a form of surgery. The mention of the word surgery frightens my patient. But for benign prostate enlargement, we do not really need to do an open or even a keyhole surgery, because the entire operation is done through a fine tube that's inserted through the opening of our urine tube. So it is an internal form of operation, or we call it 内窥镜手术. The surgery does not take more than an hour. There is no open or visible wound in the body. By doing surgery, it offers a more long-term solution. Once a person has undergone this surgery or procedure, the person need not take medication. The recurrence rate from a successful surgery is less than 20% in 10 years, which means 80% of our patients after 10 years continues to enjoy good urine flow despite not taking any medications after a successful surgery.
Traditionally, an electric knife was used during a prostate surgery. However, knowing that the prostate is a very sensitive organ, the doctors have compelled themselves to develop a unique device, one that doesn't make you bleed at all.
By using green light laser, we direct the laser light onto the prostate tissue and we vaporize the prostate tissue. When we vaporize the prostate tissue, it has the same effect as cutting away the prostate tissue. By vaporization, we actually make the tissue disappear. But the main advantage is that when we vaporize with the green light, we also control all the blood vessels. Because when we study the wavelength, we realize that green light is well absorbed by red cells. So this green light is directed at these red cells or blood vessels, and it will seal the blood vessel at the same time as we are vaporization. So with this newer technique, which takes exactly the same amount of time as the traditional operation, we are able to significantly reduce bleeding from surgery. And it is very, very important as we see a new group of patients emerging recently. This new group of patients are usually older patients, patients with concurrent medical problems such as heart problem, diabetes and high blood, and very often they are taking blood thinning medications such as aspirin, Plavix, which cannot be stopped at all cost. So if we were to perform the traditional operation on this group of patients, the risk of bleeding is significantly high. With the availability of green light laser, we are able to achieve the success of unblocking the prostate, but by minimizing blood loss and shortening their hospital stay.
Despite such medical breakthroughs, it is not to be taken for granted. When we come back, we shall learn what happens when the prostate turns cancerous.